Hi, my name's Stewart Kerr and I wanted to introduce you to our ultrasound machine at the clinic, but also talk a little bit about ultrasound imaging and its particular benefits. So this machine is a really high quality machine. It has excellent ability to create a quality image, and that's in part to do with the technology within the machine, but also the technology of the probe, also known as the transducer. And modern technology allows for really high frequency of ultrasound wave to be produced by the transducer, which in turn creates an even better image. So ultrasound imaging can be really useful at looking at lots of different musculoskeletal structures, and I'll just talk through one or two of them at the moment. So what we're looking at here is one of my thumb tendons. So we can see that just at the top of the image here. This machine's got a handy little drawing function, so I can just demonstrate that the structure in between the orange lines is the tendon, and it looks a little bit like steel cable. So ultrasound is fantastic at looking at tendons in particular, and indeed is considered the gold standard. And that's for a few different reasons. Firstly, it's the only imaging modality that is considered real time. So by that we can evaluate the integrity of these structures with the patient in front of us, and we can apply some of our normal clinical tests or movements while we're actually visualizing beneath the skin. That you can see that quite nicely in some of the finger flexor tendons. If I wiggle my fingers, you can see them moving quite nicely at the top and centre of the image. The other advantage of ultrasound is the Doppler imaging that comes with ultrasound. So we can actually look at blood flow in and around tendons, and that gives us an awful lot of diagnostic information. In certain inflammatory conditions, you can see quite a lot of extra or adverse blood flow on Doppler imaging. So these key things are unique to ultrasound, and is why ultrasound is considered the gold standard in tendon imaging in particular. But it's not limited to tendons by any means. Here we can see into my wrist, and if I just freeze that, it's there. You can see the bottom end of my radius, and then one of the carpal bones here in my wrist. Again, we can look at this in a dynamic fashion. So I can move my wrist up and down, and we can see what happens between those two joint structures and evaluate, see if there are any issues that might correlate with symptoms. We can also look at nerves. Another example of that would be the carpal tunnel. So we can look at the carpal tunnel, which most people will be familiar with carpal tunnel syndrome, and ultrasound is a fantastic way of diagnosing carpal tunnel syndrome, and we can actually look at the nerve that's affected in carpal tunnel here, known as the median nerve, and we can measure its thickness here and at various other points, and it shows a really strong correlation with accurate diagnosis of carpal tunnel syndrome. So these are just a few of the key and perhaps unique benefits of ultrasound, and in particular using the high quality machine we have here at LifeFit Wellness.